recording or yeah. So in today's class, what we will discuss is basically how to assess dehydration in a child. So that is very important. So we have, as per the PALS algorithm, we have completed all the tachycardia, bradycardia, post cardiac arrest algorithm, everything. Now it's the we will discuss the how to assess dehydration. So that is very important. So dehydration, as you know, like in respiratory issue, the one of the most common second presentation, whatever be the child will have, is something related to an acute diarrheal disease or multiple episode of vomiting, or the child is not taking food well, maybe an acute gastroenteritis. So that will be the one of the most common reason why the child is having a dehydration. So you should know by looking at the child whether the child is having dehydration. If dehydration is there, what is the level of dehydration the child is having? It is very minimal dehydration, or it is moderate dehydration, or it is a severe dehydration. So this is a very important things that you need to assess by looking at a child who has come with probable evidence of dehydration. So that is very important. So dehydration, what do you mean by dehydration? Dehydration means loss of fluid as well as water, fluid or water from the body. Mainly what is losing is either the fluid. What could be the main reasons for dehydration? The most common will be in a child will be diarrhea, acute diarrheal diseases. The second can be vomiting. Third, what is the climate right now? Because it can due to it is, the climate is very bad, so the as a result it can lead on to heat exhaustion, or later on the child can go into a heat stroke also. So heat stroke or heat exhaustion. So these are the main reason why a child can have an acute dehydration. See, dehydration, all child with dehydration will not go into hypotension. So I'm not discussing about hypotension at all. I'm just discussing regarding, I'm not discussing regarding shock. Shock, we will deal it separately. So the one of the reason for shock is hypovolemic shock. Among those hypovolemic shock, one of the reason is any of these things. So loss of water from the body. So we are just going to deal with one of the most important aspect of a child, that is dehydration. And when the child is coming with multiple episode of vomiting or loose stools, you need to assess them and you need to decide, okay, this child is having severe dehydration, this child is having only very minimal dehydration, so we can treat with oral rehydration solutions. This child require an IV access, this child doesn't require an IV access. You need to take those decisions. So that is very important. So dehydration assessment, the most important thing what you can look in is the how is the child, how the child is active. Even with multiple episode of vomiting, multiple episode of loose stool, the child is quite active. That means there is only minimal dehydration. That's the first clue that will give you that the child is having very minimal dehydration only. Where the child is very active, child is talking to you, the child is smiling, child is otherwise active, but he is only having this multiple episode of vomiting or loose stool. So that is the first thing that you can see. Okay, the child is otherwise stable, so the child is having only a minimal dehydration. The next thing is that you can look at the eyes of the child. The eyes are sunken eyes. The sunken eyes will be in one of the early features of your dehydration. So sunken eyes, you have to look for the next important clinical features, that is called as sunken eyes. So for the first one, you look at the how child is active or not. The second one, you look for sunken eyes. Instead of child, the child is lethargic. What does that mean? The child is very much lethargic. There is dehydration. There is mild to moderate amount of dehydration for that child. The child is lethargic, and if the child is comatose, there is severe dehydration. So depending upon the activity of the child, you can say, okay, the child is active means very minimal dehydration, mild dehydration. The child is otherwise lethargic. There is mild to moderate amount of dehydration. The child is very much comatose and drowsy. That means there is severe dehydration. So you have to understand that. So that is the amount of dehydration that you need to see. Then, as I told, sunken eyes. Next, what will be the next thing? You just generally see the how the skin is. Looking at the skin, there will be some amount of moisture in everyone's skin. So the skin is very dry, and the skin is very dry for the child. There is some amount of dehydration. So that is the skin turgor, or skin, not turgor, skin, the surface of the skin. By looking at the surface of the skin itself, we can say. The next important clue that you can see, you can ask for urine output. How well the child is making urine. The child is making good amount of urine, that means the child is okay. There is no issue. Even after this multiple episode of loose stools and diarrhea, still the child is making good amount of urine. Even if it's a small child, they want to change the nappy every 3 hours. That means the child is passing urine. So that means the child is okay. The child is having thirst. The child wanted to drink more and more water. That means the child is definitely having dehydration, but it's again mild dehydration only. So the thirst part is very important. So the child is feeling thirsty. So that is again one of the sign that the child is having dehydration. So the thirsty is very good. The child can have thirst, but he is able to drink water. That is well and good. So thirst is the next thing. And one of the important thing that you can look is something called as skin turgor. So what is mean by skin turgor? So what do you mean by skin turgor is, you just take the child's hand and you pull the skin little bit up and you release it. So normally the skin wax goes very fast. Immediately it will go. So if it is immediately going, that is normal. So if it is taking some time, like less than 2 seconds, like in capillary refilling time, it is taking less than 2 seconds, there is mild to moderate amount of dehydration. And if it is taking very long time, more than 2 seconds, that is severe dehydration. So looking at the skin turgor. So what is skin turgor? This basically you pull up the skin little bit up and you release it. Immediately it will go. But when you pull up the skin and if it is going only within 2 seconds, that means the skin turgor is poor, and if it is more than 2 seconds, it's very poor and it is showing severe dehydration. So that is one of the important bedside tool that you can look at the child and you can see whether how much the child is dehydrated or not. So the most important thing what you can look is the sign is skin turgor. The next thing, as we all know, the capillary refilling time, less than 2 seconds and above 2 seconds. Above 2 seconds, definitely the child is dehydrated. So definitely there is poor perfusion and the child is in severe dehydration. So that is the next important thing. So these are the general clues. So what are the important things you look at? Why there is altered sensorium? Because of poor perfusion to the brain. Because there is poor perfusion due to less number of fluid in the body. As a result, the volume has come down. As a result, there is a poor perfusion to the brain. That is the reason why the child is becoming lethargic and later on becoming drowsy. So that is one. Next one, what you have to look in for the sunken eyes. How is the sun? Then you can just simply ask them to pull out the tongue and see the tongue is very much dry. That means the child is having dehydration. So that is mild to moderate dehydration. So again, you can see the oral mucosa. How is the oral mucosa? The oral mucosa is again very dry. That is again a clue that the child is having severe dehydration. Then you have smaller children, less than 1 year and all. There is something called as anterior fontanelle. I don't know if we have touched a small kid. You can just palpate here. There will be a small depression in the center of that is called as anterior fontanelle. See, anterior fontanelle, usually it will be bulged. That is a normal thing. So then normally it will be bulged like this. But when you are palpating the anterior fontanelle, you are able to not to see that bulge. The bulging of anterior fontanelle is lost. That is again one of the sign of dehydration. So anterior fontanelle, there is something like your you have the skull here, you have the suture lines. So there is something, a small diamond shape of a defect here. So that is what is the anterior fontanelle. So it is usually it will be bulging. When you see the next kid, 1 year old and all, you just see it will be bulging like this. If it is not bulging, if it is depressed, that is again one of the signs that the child is dehydrated. So anterior fontanelle also you can assess for. So these are the areas. I am not telling any vital signs. So tachycardia, bradycardia, hypertension, I'm not discussing those things. That will be definitely there with the associated these signs if the child is having associated hypertension also. But what I am saying, by looking at the child, you have to say that, okay, this child is having multiple episodes of loose stools. The child has come to you, whether it's a mild, moderate or severe dehydration. So now the treatment also depends upon the severity of the dehydration. The child is severely dehydrated, not able to take oral feeds. What you have to give? You have to give IV. The child is able to take orally, well and good. Oral feed is more than enough. The child is not able to take orally, then only you need to give IV. Otherwise, there is no need of IV. When the child will not be able to take orally, the child will have multiple episodes of vomiting. Whatever you are giving, the child is vomiting. Or the child is quite drowsy, not able to take any of these things. The child is in significant hypotension, like skin turgor, more than 2 seconds and all, the child will be drowsy and lethargic only. So those group of child, you cannot ask the child to drink water. So those group you definitely need to give IV fluids. So How to treat dehydration, that we will deal separately. Now, what here that I will teach you along with hypotension. How will you manage hypotension and hypovolemic shock? What is the fluid of choice that you need to give? All those things that we will discuss. But right now, what you should understand is that how you should assess a dehydration in child and what are the common reasons for dehydration in a child. The most common reason being one of the thing acute diarrheal disease. The second one being the most important meaning, it can be vomiting secondary to any reason. It can be due to gastritis or it can be a part of your acute gastroenteritis, any of these things. And third thing, it can be related to heat exhaustion or the child is not taking enough water, all those reasons. But the most common, you have to understand that it is acute diarrheal disease, lot of loose stools. Remember that the simple rule of treating any dehydration is that depending upon the severity of dehydration, you treat the child. If the child is having mild to moderate, but still the child is able to take orally, oral feeds is enough. And how much oral feeds? What is the normal requirement? What do you mean by maintenance fluid? What is mean by all those things that I will teach you in the next class. But you remember that the simple rule is that if the child is able to take orally, otherwise tolerating oral feeds, oral fluids is enough. Oral rehydration solution is enough. The child is not able to take orally, IV you have to give or an IU access depending upon the severity of dehydration. Sometimes you will not be able to get an IV access because the child will be severely dehydrated. When you are trying to poke the child, you are not getting an IV access. So that is the time when you have to go for an IU access. So intravenous access or IV access, you need to give fluids, and fluid is not enough. You need to give nutrition also. So nutrition, and also you need to give electrolytes. Which all electrolytes have lost from the child, you need to supplement that also. So that part also we will discuss in the next class. So remember that assessment of dehydration, you start from head, as I told, anterior frontal layer, simple thing, anterior frontal layer, look for the sunken eyes, look for the oral mucosa, and also ask them to put out the tongue. See the general whether the child is drowsy, lethargic, or the child is active. Look at the skin in total. What is the skin? Turgor, that is the one thing that you can look for. You pull out the skin and see whether the skin is coming off very quickly. If it is coming off and going back, that means there is no skin turgor is normal. If it is taking less than 2 seconds, there is moderate dehydration. Then it is more than 2, it is severe dehydration. Then you look at the urine output. See how the child is having good amount of urine output or not. So these are the simple things by which you can see, and also you can look for the capillary refilling. And by looking at these things, you can say that the child is having mild dehydration or moderate dehydration or severe dehydration. Depending upon the level of dehydration, we need to treat the child. So maybe in treatment aspect, we will be using the term called as some dehydration, no dehydration, and severe dehydration. There is some differences, that terminologies I will let you know in the next class. But remember that you need to assess a child and you need to decide, okay, by looking at the child, you need to see multiple episode area, you need to see, okay, the child is otherwise stable, so oral rehydration solution is enough. You can start them giving oral rehydration solutions. There is no need to ask. But the child is unable to tolerate multiple episode of vomiting, you need to definitely give them an IV fluids. So what fluid, everything we will discuss in the next class. What is maintenance fluid? What is the fluid that you need to give for replacement fluid? Hypovolemic shock, all those things we will discuss in the next class. Okay. Thank you.